Today we stand on the threshold of delivering historic health care reform. With 14,000 Americans losing their health care every day, we have no time to lose. The status quo is serving women particularly poorly. 64 million women lack adequate health insurance. Over half of all medical bankruptcies are filed by female-headed households. Secure, high-quality, affordable health care is simply out of reach for too many women and their families.
We can and we must do better. And that is what our health care reform legislation will do. Our health care reform will make sure that every woman has access to quality, affordable health care, and that they are not being charged substantially more than their male counterparts for the same benefits, up to 45% more. There's something awfully wrong with that picture. It will guarantee that insurance companies provide common sense benefits like mammograms so that we can be about the business of prevention. And it will keep these insurance companies from denying coverage based on a pre-existing condition, whether that means providing health insurance to a breast cancer survivor or allowing a soon-to-be mother to add on maternity benefits. We cannot allow the current system to continue to break Americans' families, businesses, and economy. And we must not allow it to break American women.
A lot of men, you know, free riders, they figure, I'm never going to really need medical care. Well, really, but a woman does, period. She needs quality health care. And if she becomes pregnant, she has to have quality health care for the sake of that child. So, you know, we're a community. We're trying to make this a national community where everyone cares about each other. And there is no more important thing we can do for the rest of our community than to get this bill passed.
I came to the health care debate first as a woman and a mother, and only recently as a journalist. This isn't my normal beat. I gave birth to a beautiful, healthy baby girl at a hospital in suburban D.C. on January 13th, 2009. 2 weeks after the baby was born, the hospital bill arrived. Insurance had denied the $10,000 bill for my labor and delivery. We were sure it was a mistake. After all, we'd already paid $12,000 in insurance and deductibles for maternity coverage. In total, it meant the pregnancy and birth cost us well over $20,000. We began fighting the bill, and we got nowhere. 6 months into our fight with hospital administrators, we were told we could no longer delay the bill. We were being turned over to collections. We don't own our own home. We didn't want that on our credit report. He suggested we throw it on a credit card. Too many Americans with health insurance have been forced to do this. A recent Harvard Medical School study found that 62% of declared bankruptcies were by people with staggering medical bills like our own, even though 78% of them, like us, had health insurance. So I decided to write a story about our experience and our increasing desperation, and I called CareFirst's press department. That day, our claim went back under review, and last week a top customer service manager in Baltimore called to tell me our policy had been changed. CareFirst would now pay 90% of the hospital fee. But not everyone's a journalist. Until this battle, I believed that health insurance was a problem for the uninsured. I didn't realize I was a part of the conversation. When you buy a policy that claims to include maternity care, it should actually cover maternity care. But when you buy insurance on your own, there is no guarantee that what you pay for is what you get.